You're sitting at dinner with your family. You can hear every voice around the table. You hear the laughter. You hear the dishes. You even hear someone speaking directly to you. But the words do not arrive clearly. So you lean forward. You watch their face. And then you ask the question you may already be tired of asking. Could you say that again? This is one of the most confusing hearing changes after 60, because it does not always feel like hearing loss. The sound is there. The voice is loud enough. But parts of the sentence seem blurred, mixed together, or missing. In a quiet room, you may follow the conversation fairly well. Then you enter a restaurant, a family gathering, or a room with the television playing in the background, and suddenly, everyone seems to mumble. Women's and children's voices may become especially difficult to understand. Words such as sit, fit, and six may sound almost the same. A person may speak clearly, yet your brain receives only part of the message. This does not necessarily mean that people have started speaking less clearly, and it does not mean you're not paying attention. For many older adults, the first hearing change is not losing every sound. It is losing the sharp details that separate one word from another. Those details are often carried by softer, higher frequency sounds. When they become harder to hear, you may still detect the voice, but miss the consonants that give the words their meaning. That is why turning up the television does not always solve the problem. It may make everything louder without making speech clearer. And over time, constantly trying to fill in the missing words can become exhausting. In this video, we will explain why voices can remain audible while words become difficult to understand, why background noise makes the problem worse, which everyday signs deserve attention, and what can genuinely help. Because the earlier you recognize this pattern, the easier it becomes to protect communication, confidence, and connection. Before we continue, think about your own experience. Do people seem clear when the room is quiet, but difficult to understand when several sounds are happening at once? Keep that answer in mind. It may reveal more about your hearing than simply asking whether sounds are loud enough. To understand why this happens, it helps to separate two things: hearing sound and understanding speech. They are not exactly the same. You may still hear that someone is talking. You may notice the rhythm of the voice. You may even know whether the speaker sounds calm, excited, or upset. But understanding the exact words requires more detail. Speech is built from many different sounds. Some are strong and easy to detect. Others are softer, shorter, and much easier to miss. Vowel sounds usually carry more volume. Consonants often carry the detail. Sounds like S, F, Tch, Sh, T, and K help separate one word from another. When those softer details become harder to hear, speech can lose its shape. The sentence is still there, but it may sound incomplete. That is why someone could say a full phrase, while you catch only part of it. For example, please sit near the door may sound more like please near the. Your brain then has to guess what belongs in the missing spaces. In a quiet room, this may work surprisingly well. You use the speaker's face. You use the topic of the conversation. You use memory, context, and body language. Your brain fills in what the ears did not capture clearly. But this becomes much harder when there is background noise. A running television, clattering dishes, several people talking, traffic, music, or even a fan can cover the softer parts of speech. The voice may still be loud enough, but the details are buried underneath everything else. This is often why a person says, "I can hear you. I just cannot understand you." It is also why asking people to speak louder may help only a little. Louder speech is not always clearer speech. If the important details are already distorted or masked, increasing the volume may simply make the entire sound more intense. This can become especially noticeable when the speaker is farther away, turns their head, covers their mouth, or speaks quickly. Masks, poor lighting, and large rooms can make the problem worse because they remove some of the visual information the brain normally uses. And then there is listening effort. When speech is unclear, your brain works harder to follow the conversation. You concentrate more. You watch faces more closely. You predict the next word. You compare what you heard with what would make sense. For a few minutes, this may not feel like a major problem, but over an entire meal, meeting, phone call, or family gathering, it can become mentally exhausting. You may begin losing the thread of the conversation. You may answer the wrong question. You may smile even when you're not sure what was said. Or you may stop asking people to repeat themselves because you do not want to interrupt again. That is how a hearing problem can slowly become a communication problem. And if it continues, it can also become a confidence problem. The important point is this. Hearing loss does not always begin as silence. Sometimes it begins as missing detail. The room still sounds full. The voices are still present, but the meaning becomes harder to reach. To understand where those missing words go, we need to follow sound from the room to the brain. Sound begins as vibration. When someone speaks, those vibrations travel through the air and enter the ear canal. They reach the eardrum, causing it to move. Behind the eardrum, 3 tiny bones help carry that movement deeper into the ear. Then the vibration reaches the cochlea. The cochlea is a small, spiral-shaped structure inside the inner ear. It contains fluid and thousands of delicate sensory cells that respond to different sound frequencies. These cells help convert vibration into electrical signals. The hearing nerve then carries those signals toward the brain. This entire process happens extremely quickly. But as we age, different parts of the system can become less efficient. The delicate sensory cells inside the cochlea can become damaged over time. A lifetime of loud noise may contribute. So, can certain medical conditions, medications, genetics, and the natural aging process. Once these sensory cells are badly damaged, the body does not simply grow a new set, and the damage does not always affect every sound equally. High-frequency sounds are often among the first to become difficult to detect. This matters because many of the softer consonants that provide speech clarity are found in those higher frequencies. The deeper vowel sounds may remain easier to hear. That means you still receive the louder shape of the voice, but the fine edges of the words may be missing. Imagine looking at a sentence in which several letters have been erased. You can still see that words are present. You may understand some of them, but the more letters that disappear, the harder you must work to reconstruct the message. A similar process can happen with speech. The ears send an incomplete signal. Then the brain tries to fill in what is missing. But the inner ear is only one part of the story. The brain must also organize and interpret everything the ears send. It has to separate the speaker's voice from the television. It has to ignore dishes, traffic, music, and other conversations. It has to follow the timing of speech. And it has to match rapidly changing sounds with words you already know. With age, these listening tasks may require more effort. The brain may process certain sound details less quickly or less precisely than it once did. That does not mean a person is losing intelligence. It means the auditory system has less clean information to work with, while the listening environment may be demanding more. This becomes especially noticeable when people speak quickly. By the time your brain finishes interpreting one incomplete phrase, the speaker may already be halfway through the next sentence. The same problem can happen during group conversations. Your attention shifts from one voice to another. Someone interrupts. Another person laughs. A chair moves. And the voice you're following becomes buried for just a moment. That moment may be enough to lose the meaning of the entire sentence. Both ears also work together. They help the brain identify where a sound is coming from and focus on one voice among competing sounds. If one ear hears less clearly than the other, this teamwork may become less effective. You may find yourself turning your head to place the stronger ear toward the speaker. You may understand people better when they sit on one particular side. Or telephone conversations may feel much clearer in one ear than the other. These patterns are useful clues. They can help an audiologist understand whether the difficulty comes mainly from reduced sensitivity to sound, reduced speech clarity, an imbalance between the ears, or a combination of factors. This is why a basic question such as "Can you hear the beep?" does not tell the whole story. Hearing tests can measure how softly you detect different tones. But speech testing can also examine how clearly you recognize words. And testing in background noise may reveal difficulties that are not obvious in a completely quiet room. The real problem is often not that the ear receives nothing. It is that the ear and brain receive an incomplete, less precise version of the conversation. The voice reaches you, but some of the information needed to understand it does not. This type of hearing difficulty often appears in very specific situations. Restaurants are one of the clearest examples. Several voices, clattering dishes, music, and room echo all compete with the person you're trying to hear. The same thing happens during family gatherings. You may follow one person well, then lose the conversation as soon as someone else starts talking. Television can also reveal the problem. The background music may seem loud, while the dialogue still sounds unclear. Phone calls may be harder because you cannot see the speaker's face. And if someone speaks from another room, turns away, or talks while walking, the words may disappear even though the voice remains audible. These patterns are useful. They show that the problem is often not simply volume. It is clarity. And when speech clarity begins to change, it is worth paying attention before communication becomes more tiring. When understanding speech becomes harder, people often begin changing their behavior. They avoid noisy restaurants. They speak less during group conversations. They stop answering the phone as often. Sometimes they smile, nod, or pretend they understood. Not because they do not care, because asking for repetition again can feel uncomfortable. Over time, this can lead to frustration, fatigue, and less confidence. A person may appear withdrawn when the real problem is listening effort. That is why hearing clarity matters far beyond the ears. It affects communication, relationships, independence, and the feeling of staying connected. Hearing changes often develop gradually, but they should still be evaluated when they begin interfering with conversations, television, phone calls, or daily confidence. Schedule a hearing assessment if people seem to mumble often, if one ear seems clearer than the other, or if you keep increasing the volume without understanding speech better. Seek prompt medical attention if hearing changes suddenly, especially if one ear becomes noticeably weaker over hours or days. Sudden hearing loss may need urgent treatment. Also seek help if hearing changes appear with severe dizziness, ear pain, drainage, weakness, facial drooping, or other new neurological symptoms. Do not wait for the problem to become severe. A proper hearing assessment can help identify whether the issue involves earwax, infection, medication effects, age-related hearing loss, or another cause. The goal is not to assume the worst. It is to understand the problem early enough to protect communication and quality of life. What helps depends on the cause. Sometimes the first solution is simple. Earwax may need to be removed safely. A medication may need to be reviewed. An infection or another ear problem may need treatment. If age-related hearing loss is involved, a hearing professional can explain which options fit your needs. that may include hearing aids, assistive listening devices, television systems, or phone settings that make speech easier to follow. But technology works best when it is adjusted correctly. More volume alone is not always the answer. The goal is better speech clarity. Daily communication habits can help too. Ask people to face you when they speak. Reduce background noise when possible. Move closer instead of asking someone to shout from another room. Choose quieter tables in restaurants. Turn off the television during important conversations. And let family members know that speaking clearly and slightly more slowly is more helpful than simply speaking louder. Protect the hearing you still have. Use proper hearing protection around loud tools, machinery, concerts, and other intense noise. Do not insert cotton swabs or other objects deep into the ear canal. And review medications with a qualified healthcare professional if hearing changed after a new treatment or dosage adjustment. Most importantly, do not wait until communication becomes exhausting. The right support can make conversations easier, reduce listening effort, and help you stay involved in the moments that matter. If you can hear voices but still miss the words, do not assume that everyone has suddenly started mumbling. The real problem may be a gradual loss of the softer details that make speech clear. Pay attention to the pattern. Is conversation easier in a quiet room? Do restaurants, television, phone calls, or group gatherings make understanding much harder? Does one ear seem clearer than the other? These details can help a hearing professional understand what is happening. Small changes can also make conversations easier. Reduce background noise. Move closer to the speaker. Ask people to face you and speak clearly. And arrange a hearing assessment before listening becomes exhausting. This video is for educational purposes only. It does not provide a diagnosis or replace personalized advice, testing, or treatment from a qualified healthcare professional. Any optional hearing support resources listed below this video are provided for general information only. They should never replace a professional hearing assessment, and you should speak with your healthcare provider before using any supplement, especially if you take medication or have a medical condition. If you found this video helpful, subscribe to Silent Health Triggers. Here, we explain the quiet changes that can affect life after 60, without fear, exaggeration, or miracle promises. And tell us in the comments, do you understand people clearly in quiet rooms but struggle when there is background noise? Your experience may help someone else recognize the same pattern. Take care of your hearing. Stay connected, and we'll see you in the next video.